Okay, so my name is Giselle and this is Bridget, and today we're going to be doing our presentation for voice analysis. Um, Voice analysis is the process of studying and interpreting the characteristics of voice signals to understand various aspects of speech and sound production. Speech therapy regarding voice analysis is used to diagnose and treat voice disorders that can arise from problems in the vocal folds, respiration, and resonance. Populations with certain communication disorders may struggle with voicing. Um, a great way to treat is by incorporating Speak Out, which is a therapy program designed for people with Parkinson's disease and other related neurological disorders. The purpose of the program is to improve the ability of functional communication.
Okay, so for the goal is to examine the differences in voice characteristics during pre-intent and post-intent phases of speech production using a combination of quantitative and qualitative analysis. So some of our research questions are, how does voice analysis differ between pre-intent and post-intent phases in speech production? And is there enough research regarding the differences to pre-intent and post-intent voicing mobility? So for our literature review, we chose six different research articles, and the general consensus was that the articles supported that intensive voice treatment, such as Speak Out and LSVT, improve speech intelligibility, articulation, and volume. And to be a little bit more specific, Article 2 was a research article that implemented Speak Out, and it reported that participants achieved a statistically and clinically significant improvement in speech intensity, pitch range, variability index for pitch, sustained vowel duration, reading intelligibility, and vocal quality after Speak Out. For Article 4, 6 out of the 8 clients improved significantly after voice treatment. This article studied sentence intelligibility pre and post treatment, and the treatment used was the Lee Silverman voice treatment. LSVT for short. And then the last article I will talk about is Article 5. So this article was also about Speak Out, and it was 6 adults with Parkinson's disease, and they completed 12 Speak Out sessions, and the results showed significant improvement in communication participation. And it's also interesting because most of their sessions were done via telehealth. Yeah.
Okay, so now I'm going to cover the methods regarding the population and sample and the data collection techniques that we used. Um, for population, the targeted population for this study will included adults aged 65 and older who had Parkinson's disease and were experiencing hypokinetic dysarthria. The setting the research will be conducted or was conducted at the Stanley Center for Speech and Language, and we did have a sample of 7 individuals to represent the population accurately and to also provide sufficient results. Data collection techniques. So I did mention that we collected both quantitative and qualitative data. For individuals with Parkinson's, for individuals with Parkinson's involves structured observation and recording progress through voice or video recordings and also observe areas targeted by the program, such as phonation time, frequency range, and speech intelligibility rate. And then we also did include a self-report or a questionnaire. And it was provided during pre-voice intent to assess general impact of hypokinetic dysarthria voicing characteristics. For our statistical analysis, we use a parity test, which compares the means of the same group of people on 2 different occasions. For this experiment, we used it to measure pre-voice analysis and also post-voice analysis. So we measured the before and the after.
So for our experimental procedure, a total of 7 individuals we will be participating in this experiment. A pre-therapy voicing sample will be taken from each participant. The sample will be analyzed according to speech intelligibility, phonation time, and frequency range. The participants will also be given a questionnaire that will assess the general impact of their voicing characteristics due to the hypokinetic dysarthria that normally causes breathiness and reduced vocal loudness, amongst other things. After that, the participants will then undergo 10 speak out group sessions. After the last session, a second voicing sample will be collected and analyzed, and the participants will complete another questionnaire. And then for our hypothetical result, the results of the experiment reported that 6 out of 7 participants increased overall speech intelligibility rates and reported improved vocal quality. There was one patient that demonstrated a stagnant speech intelligibility rate, and this was due to the patient's longer duration since diagnosis of Parkinson's disease. The post-intent of voice analysis resulted in limited positive outcomes. It's important that once you get a diagnosis of Parkinson's disease that you undergo voicing treatment as soon as possible because that's how you'll get the best results.
And that was our presentation.
Thank
Thank
you.
you. And then how do I stop recording?